like to thank Dr. Nahai for selecting our paper, Microbes, Histology, Blood Analysis, Enterotoxins, and Cytokines, Findings from the ASERF Systemic Symptoms in Women Biospecimen Analysis Study, Part 3, as the editor's choice for February. This is the first prospective blinded study comparing women with self-described breast implant illness to two control groups. We elevated the qualitative data as well as biospecimen data collected on the day of surgery. In the BII groups, the concern is that implants are toxic, and whatever toxins are in the implant will also be in the capsule. 94% of the BII cohort had at least partial symptom improvement at 6 months after implant removal, and that improvement occurred regardless of the type of capsulectomy performed. There were no abnormalities identified in CBC, thyroid, or vitamin D levels. There were no statistical differences in next-generation sequencing positivity on the surface of the implant or within the capsule for bacterial DNA between the BII and the non-BII cohorts. Symptom improvement after explantation was no different between the next-generation sequencing positive and negative subjects. Only 2 of 96 capsules demonstrated any eosinophils, and without elevations in eosinophils in the tissue or the blood, an allergic etiology is unlikely. Further, there were elevations in 3 of 12 cytokines in the BII cohort, and this occurred in only a minority of the subjects, all but 1 having coexisting systemic illness. Finally, anti-Staph enterotoxins were identified in 18 BII subjects, only 3 of which had positive PCRs, and all of the positive PCRs were for Cutibacterium, not Staph. This suggests they might have developed Staph enterotoxins to a past or present infection elsewhere in the body. This study is good news for women who believe that their implants are related to their systemic symptoms, as it contributes to the growing peer-reviewed literature that documents capsulectomy does not contribute to symptom improvement. Patients can be barraged by unscientific opinions on social media and by explant experts who may be taking advantage of their fears and pocketbooks. We are currently drafting our 4th paper that will review the 1-year study data. With 96% follow-up, we have substantial data that supports alternate potential etiologies for systemic symptoms that some women attribute to their breast implants. We plan to submit the 4th paper to the Aesthetic Surgery Journal in the next few months. Thank you.